outbreak that is affecting 24 member states. And it's my honor and pleasure to really allow us to give a round of applause for Dr. Ngashi here. He's the one leading that exercise. Please. So, colleagues, the continent is at a crossroad. Today, we are seeing 41% increase in the frequency of emerging and re-emerging infectious disease outbreak on our continent. We have moved from 150 disease outbreaks per annum to over 200 disease outbreaks per annum. We are seeing rising nationalism. We are seeing weakening of multilateralism. And we are also seeing declining development assistance for health. This fellowship was created to equip our public health leaders with the necessary strategy, ethics, and transformative skills needed to guide our continent, our member state, through these sort of complex health and economic challenges. Your Excellencies, the program is part of a broader vision to develop a 21st century health workforce that is capable of driving health reform, strengthening systems, and advocating for Africa on the global stage. From national ministries of health to regional institutions and global platform, our alumni are already making a difference as far as the global health space is concerned. Today, we have ministers among our alumni. We have commissioners among our alumni. We have country leadership as far as different programs is concerned. And just of recent, I think we also have a deputy vice chancellor among our alumni. I think that attests to the quality and the support, that we gather from this program. Dear fellows, our continent is going through financial crisis as far as health spaces are concerned. Today, we have seen our development assistance for health declining rapidly by around 70%. We have moved from 81 billion to 25 billion. On top of that, we are also facing huge crisis as far as servicing our debt in terms of the obligation to service our debt is concerned. As I mentioned earlier, we're also seeing rising in the frequency of disease outbreak. So when you look at the financing space, it's not looking good, So why I'm bringing this is that our fellows, you are coming at the very right time, and one of the biggest tasks before you is to really join Africa CDC to support our member states to navigate through this difficult terrain. And in that regard, we have launched what we call the health financing, rethinking health, is underpinned by three critical pillars, which is one, domestic health financing for health. How do we ensure that we attain the target that was set by Head of State 2001? How do we come up with some innovative ways of financing our health? And what sort of blended financing that is out there that we can leverage really to support the health financing space as far as our continent is concerned? And for you as leaders, what sort of governance, what sort of efficiency are you going to introduce in that space so that at the end of the day, we have investment in the health system that will guarantee our health security and our universal health coverage? So I challenge you to really work with Africa CDC in this space. In fact, for me, this is your number one task, and some 6 months down the line, we will convey again, and the biggest question will be, what are you doing in that space to support Africa CDC and to support our member state? So let me, on behalf of the DG, His Excellent Dr. Jan Kesea, to say that you are and you always be part of Africa CDC. That the DG is guaranteeing you. We count on you to serve as our ambassadors. We count on you to continue to drive Africa CDC agenda. We count on you to continue to champion public health as envisioned by Africa CDC and the African Union. We count on you to continue to drive the Agenda 2063, especially the health agenda of Agenda 2063, the Aspiration 1 Go Free, So, and we count on you to support our member state that 5 years from now, talking of the SDG, Agenda 2030, you'll be able to support our member state to move as close as possible to those targets, as far as the Sustainable Development Goal 3 is concerned. So we would like you to stay engaged. We encourage you to remain active through the alumni platform that we have set up. And this will offer ongoing leadership and collaboration opportunities. As I said, you will remain and continue to be part of Africa CDC. So what we want from you, stay engaged through the alumni platform. And we will leverage on your expertise and skill, to drive our programs, including the Kofi Annan itself. We have various leadership programs, scholar program, the African Epidemic Services. So this is time for us to also benefit from you. So please do stay engaged. So let me close by saying that African Union is proud of you. Our member states are here. Africa CDC is proud of you. The Africa CDC leadership is here. And much more importantly, the legacy of Kofi Annan, we count on you to keep that vision, that boldness, that service, that selfless service, that Kofi Annan preached during his lifetime. So we count on you to continue to really keep that flag flying. We want you to continue to lead with integrity, lead with courage, lead with compassion. So finally, I would like to congratulate you one more time. Thank you.
Round of applause for Dr. Taj, please. Let's keep it going. Thank you. And Martin, let me give you a heads up that Professor Julio is not around yet, so you'll be next on the agenda. Fellows, you have the invitation there, as well as a challenge. I've known Dr. Taj for many years. He's a man of his word. And so the invitation to come into the CDC, to work with leaderships, to work with member states represented here, and those that aren't represented here, is live and is open. So please take it and accept it. Before I call on Martin, let me also just welcome representatives from Cape Verde that have joined us. Round of applause, please. Welcome. And other CDC leadership that have joined us as well. You're most welcome. Thank you very much. And let me welcome Martin to the stage. Martin is also a founding faculty member of the Kofi Annan Fellowship. He's been here since the beginning. So actually, please give a really big round of applause for Martin, without much of which wouldn't be possible. Thank you.
The Director, Africa CDC, represented by the Dr. Taj, Acting Director, Deputy Director General, Your Excellencies and distinguished guests, Senior Africa CDC leadership, Africa CDC colleagues, and most importantly, the graduating Cohort 4 Kofi Annan Fellows. Good afternoon. I'm really very privileged and really humbled to stand here before you to witness the 4th Kofi Annan Fellows graduate. 4.5 years ago, when we conceived and started implementing this project, we were not very clear of what caliber of fellows will get into the program. But to the testimony of the 59 fellows that have graduated, and indeed the class of Cohort 4, it's really, really amazing to see the high quality of public health practitioners. But even more interesting is the excellence, the passion, the promise, and the camaraderie they develop among themselves, which gives us great hope for the future of public health on the continent. But as I graduate today, as you graduate today, I would like to say graduation is not the end. Rather, it's the beginning, just as the Director General mentioned. Today we gather here to celebrate not just your achievement, but indeed the promise that you represent for Africa's health security. You are the next generation of leaders in public health, and leaders our continent and indeed the world need. You are graduating at a very challenging time, as expounded by the DG. We have the convergence of the conflicts, of the climate change, of outbreaks, of natural disasters, and many other challenges, funding and the other resources. So it is a huge task before you. But allow me to reflect on the role of public health leadership on the continent. For this reflection, I'd like to share with you 4 main points. The first one is the empathy and the compassion. Fortunately, empathy and compassion is very deep in our African culture. Now, these qualities are not just enough. They are actually essential for practicing public health. Today, technical expertise, competency is not all you need. We need leaders that will listen, that will understand, and care for our communities. Over the past 1 year, I've seen you, I've observed you, and truly you reflect empathy and compassion that we need in today's world. We have seen the division and the difficulties there are. Apart from your technical expertise, you need that. The second thing I'd like to share with you is actually in the form of a question. Are we lucky to be Kofi Annan Fellows? Are you lucky? Now, the class of the class of cohort 4 is among over 15,000 applicants to the program. So you are selected, you are here, but is it because you are lucky? Not really. Science tells us that luck is not just a random event. And I can share you with an example. There is a study which was done, and 20 people are given a newspaper to count the number of images in that newspaper. And some of them finished that task within a few seconds, 2 to 3 seconds. The rest had to count every page and went through. It took 3 to 4 minutes. But for those who are keen, at page number 2, the experimenter had inserted a big box which said, you don't need to read any further. This newspaper has 43 images. And the message here is that those who finished early, they are people who are alert, always on the lookout, ready to classify themselves as lucky, self-lucky. And the message is that those of you who are here today, graduating today, it's not that you are lucky. It's because you are alert, you are conscious of what's happening around you, you are vigilant, and you invest in yourselves. So that's the second thing I would like to share with you. And I would urge you, when you go out there, do your very best every single day and do it always. Now, the third point I'd like to share with you on reflection. I was just reflecting on my career recently, which spans over 35 years in public health. And I've come to the conclusion that public health is not actually just a job. It is a moral responsibility. And once in public health, always in public health, always practicing for the rest of your active lives. And wearing that cloak of Kofi Annan himself, you cannot escape. So I'd like to remind you, it's not a job, it's not a career development, it's a calling. And this is what our continent, Africa, really needs. So it is a responsibility that demands your very best. Finally, I would say be valuable. Add value. Don't just be present. Your time, your talent, and your voice matters now more than ever. given the current situation we have here. The future of Africa's health security depends on leaders who bring themselves fully to the table, not just to occupy a seat, but to change the conversation and to change the future. Global health, there was a recent article by Dr. Chikwe which said global public health really now needs African public health leadership more than anything else, because we are grounded at ground zero. So with those few 4 points, I encourage you, and I say congratulations, cohort 4. Go forth with courage, go forth with empathy, go forth with compassion, and with unveiling belief that you can and you'll make a difference, and Africa and the world are really waiting for your leadership. Thank you very much.
Round of applause for Dr. Martin, please. Fellows, if you didn't feel the responsibility, now I hope you're really feeling it. Martin spoke of this as being a calling, the moral responsibility, added to Dr. Taj's comments of, the alumni having ministers, deputy vice chancellors, commissioners amongst you. I hope you're feeling the gravity of the situation, as well as the celebration that this is a serious moment. But just a moment of light brevity. I think we've had the live stream working for a moment. So if I could just ask you to turn and wave to the camera, to say hi to your family and friends on the live stream, this camera behind you here. Let's welcome them. Let's make our people online feel included. You're most welcome. Thank you for joining us online. Okay, Dr. Alex, we're going to move to you next. And before you do, let me just embarrass you. He doesn't like to be embarrassed. He is the program director for the whole fellowship program, but he's been a driving force behind this. A lot of the fellows refer to him as Dr. Alex. I mean, as Uncle Alex, because of his personal nature, his ability to help people in so many different situations. Without much, none of this would be possible. So a big round of applause for Dr. Alex, please.
Good afternoon, bonsoir, boa tarde. Those are the ones I know. Honorable guests, the leadership of Africa CDC, our distinguished Kofi Annan fellows, colleagues, ladies and gentlemen. Dr. Taj, representing the leadership of Africa CDC, it is my honor to present to you 25 leading public health leaders for graduation. They have met all their requirements, and I can assure you that all 25 have passed and qualify to be Kofi Annan fellows. For these fellows, it has been a 2-year journey. The first 6 months, they did not know much about it because there is a lot of planning that takes place within Africa CDC. And I would like to thank every single department in Africa CDC that has contributed to either raising resources, managing logistics. It's a very complicated endeavor to attract the best and then take them through a year. The fellows then started applying for this fellowship in December 2023, noting that today we are in 2025. And then that followed a 6-month period of application, selection, interviews, and confirmation that these 25 fellows, out of 3,000 applicants, were going to be Kofi Annan fellows. And then in June of 2024, they started their journey, and that journey has taken almost exactly 1 year and has ended today when they completed the presentation of their final assignments this morning. The 25 fellows here represent over 20 countries. 11 of them are leading women in public health, and 14 are leading men in public health. 5 of the fellows have specialized in mental health and have been a great addition to the Kofi Annan Fellowship Program. This program in this last year has been hosted by Ethiopia, by Egypt, and by Rwanda. And we thank these countries, its people, and their governments for hosting us and making a memorable learning experience while we were there. Let me make a few thank yous. We thank our key partner who has supported and funded this program for the last 5 years. They wish to remain anonymous, but we can give them a very public clap. The Africa CDC leadership that has been with us in this 5-year journey since we began, Honorable Jean Kaseya, His Excellency Jean Kaseya, the Director General of Africa CDC, Dr. Taj, who through the years and through 3 successive leaders of Africa CDC has ensured the continuity of this program. Let us give Dr. Taj. And of course, the Africa CDC leaders who are here, but many others who are not here, but continue to support this program. Of course, the Kofi Annan Foundation, we could not have used the Kofi Annan name without the permission of the foundation. The Kofi Annan Steering Committee, some of whom the members are here, Ade and Martin. The fellows, we could not have a program if the fellows did not apply and did not apply themselves. There is applying for the fellowship, but there is applying yourself to the process that makes you a fellow. Thank you very much indeed. And of course, the host countries, as I have stated. So, people might be curious, what does it take to be a Kofi Annan fellow? There are many, many inputs that in the space of 12 months, we try to imbue into the fellows. First is that we bring them to understand what Africa Union and Africa CDC stand for. Many fellows are operating at a country level and may not be up to date with what is happening at a continental level. And in particular, we try to awaken a greater patriotism for Africa as a whole, to look beyond just your community and your country and understand that we are together and we have to be together in this journey. We teach and refresh on key public health initiatives like primary health care, like universal health coverage, like global health security. And we expose the fellows to global health diplomacy, as well as the global health architecture and the need to reform it to bring Africa to drive its own agenda. There are many other inputs, including coaching, mentoring, a research project, research and implementation project that we call a leadership challenge project. And of course, country visits that inspire us to be better than what we are by seeing the tremendous progress that countries like, for instance, Egypt, Rwanda, and Ethiopia are going through. And so after 2 years, we really have very well-rounded fellows who are global citizens, but who understand that our primary mission is going to be Africa. So let me make, as I conclude, a personal reflection. 2025 marks my 42nd anniversary as a medical doctor. I graduated in 1983. But also my 30th anniversary since I did an executive leadership program like you are graduating today, which thrust me into a position of health leadership. So I was reflecting quietly to define what exactly is public health leadership. What exactly are we trying to achieve in this fellowship and in the cohorts to come? And I will read. Public health leadership is about harnessing within individuals passion, inspiration, and trust, and combining it with humility and respect for other people. And then marrying it with scientific evidence, advocacy, and influence of many people and many institutions to achieve health for Africa. And in order to do that, we need to create an African movement, a movement of ethical and principled leaders who put the population, the 1.5 billion people of Africa, as their primary objective, and leverage our political leaders especially to drive all of us to a peaceful and prosperous Africa. Thank you, Africa CDC, for having trusted me and leveraged my passion to grow leadership, to be able to lead and produce 85 leading fellows over the last 4 years. I look forward to supporting Africa CDC to cross the 100 barrier, but most importantly, each and every one of these fellows has been tasked to go back and train other leaders so that we have a movement of thousands and thousands of public health leaders. I thank you.
Please continue your appreciation for Dr. Alex. Please continue. Thank you, Dr. Alex. You are well admired, respected, and loved. Colleagues, to add to your list of responsibilities and challenges, you have that there. Dr. Landry, we're going to call you next, please, to give some remarks on integrating mental health and sexual and reproductive health and rights into the Kofi Annan Global Health Leaders Fellowship. Ladies and gentlemen, a big round of applause for Dr. Landry, Director of the Centre of Primary Health at CDC.
Wow. Dr. Alex, let me stand on existing protocols and acknowledge once again someone unique. I was fortunate 23 years ago to be in a conference, international conference in Zimbabwe on HIV. And I still remember that was the first time I was definitely convinced that we will not address this epidemic unless we transform community engagement. And guess who was the speaker? Dr. Alex Coutinho. I was convinced from that day that public health is less about scientific evidence. It's more about translating the scientific evidence into results for people and for the most vulnerable among our population. 20 years ago, I was in the same seat as our graduate today, fortunate to be a fellow in the public health program. I was lucky, maybe, but what I believe today happened in my career is that I was on mission. And because I was on mission, that fellowship found me. 20 years down the road, I was fortunate to talk to the Kofi Annan Fellows. And I reflected on what being a fellow can add in a trajectory. And I found two key levers. The first leverage that a fellowship gives you, which lasts forever, is connection. Yes, the connection that I got 20 years ago made me part of what made me what I am today. And one of those connections, as I shared with you, is the connection with who became the first director of Africa CDC, Dr. John Kingason. It happened during my fellowship in Atlanta. So guess, in this room, we are meeting people who maybe 20 years down the road be with you somewhere, changing the world, changing the continent. The second lesson, which I shared with you yesterday, is the lesson of courage, and it's more than passion. You may want to call it risk-taking. Yes, try and go and change the world. Try and go and change the continent. You have all you need. You don't need more training. You don't need more diploma. You need to be on mission. And I think this fellowship is definitely adding that component that I learned 20 years ago. Go and change the world. My third and last message is they wanted me to talk about integration of SRH and mental health. But I think yesterday we had a conversation around PHC. PHC what? Transformation. Because the transformation is what we need for the integration to be somehow natural. Yes, vertical programs has been somehow part of the history of public health, with a mindset of tackling with case management, trying to address efficiency. But we know the limitations of those vertical programs. And the uniqueness of your fellowship is that you are graduating when the world of public health has completely changed. And it's going to be more and more about who is able to influence the policy making around budget allocation, right? It's going to be about the conversation about happening at the cabinet with the prime minister when you're minister of finance. It's challenging you. It's not going to be about how you articulate the return on investment. No. It's not going to be about the most effective intervention. No. It's going to be about how you build your advocacy, how you build alliance to convince those who have the purse to put more money in health. So let me stop here and again congratulate you on your graduation, and I look forward to continue working with you to achieve the transformation that is needed on the continent today. Thank you.
Let's keep clapping for Dr. Landry, please. Thank you very much. Fellows, please take risks. I think that's a really important call. Dr. Landry has also painted a very vivid picture for us of what your future could and we hope would look like when you're in those important meeting rooms, negotiating with leaders. So please, let's listen to that call. I'm going to call some representatives now of the cohort 4 to give us their remarks, to give us their words. I think I'm calling Jibril and Fatima specifically. So let's welcome them all. Big round of applause. Please come to the stage and give your remarks.
Je vais parler en français. Excellences, Monsieur le Directeur Général adjoint de Africa CDC, Excellences, Mesdames et Messieurs les ambassadeurs, distingués représentants de Africa CDC, Monsieur le Directeur du programme de bourse de Kofi Annan, chers membres du corps professoral, partenaires, familles et collègues boursiers, honorables invités, Mesdames et Messieurs en vos rangs, grades et qualités respectives. C'est avec un cœur rempli d'émotion, d'humilité et d'une détermination sans faille que je me tiens devant vous aujourd'hui au nom de la 4e cohorte du programme Kofi Annan pour le leadership en santé mondiale. Nous sommes réunis ici pour célébrer bien plus qu'une cérémonie de remise de diplôme. Aujourd'hui, nous célébrons l'aboutissement d'un voyage transformateur, une promesse renouvelée envers l'Afrique et un engagement sacré envers la santé de nos peuples. Il y a un an, nous avons franchi les portes de ce programme avec des espoirs, et des rêves. Aujourd'hui, nous en sortons avec une mission, celle d'incarner la vision de Kofi Annan. Celle d'une Afrique unie, résiliente, prospère, où la santé n'est pas un privilège, mais un droit fondamental pour tous. Une formation, une transformation. Cette année n'a pas été simplement une formation pour nous. Elle a été une renaissance. Nous avons appris que le leadership ne se mesure pas par les titres, mais par l'impact. Nous avons découvert que la santé mondiale n'est pas une question de frontières, mais de solidarité. À travers les enseignements, les défis et les échanges, nous avons compris une vérité essentielle. L'Afrique ne progressera que si nous, ses enfants, décidons de porter ensemble son fardeau et ses espoirs. Nous avons été façonnés par des mentors exceptionnels, inspirés par des partenaires dévoués et soutenus par des institutions comme Africa CDC, qui croient en une Afrique capable de définir son propre destin. À tous, nous disons merci. Merci pour votre confiance, votre patience et votre foi à notre potentiel. L'agenda 2063, notre boussole. Aujourd'hui, nous ne sommes plus des professionnels de la santé, nous sommes des architectes de l'Afrique que nous voulons. L'agenda 2063 de l'Union africaine n'est pas pour nous un document lointain, mais un appel à l'action. Un appel à bâtir des systèmes de santé résilients, à combattre les inégalités, à innover pour nos communautés et à garantir que personne ne soit laissé pour compte. Nous, membres de la cohorte 4, portons cette vision dans nos cœurs. Nous savons que les défis sont immenses. Des maladies émergentes au système fragile, des disparités criantes aux crises climatiques. Mais nous savons aussi que l'Afrique regorge des solutions, des talents et d'une volonté indomptable. L'héritage de Kofi Annan, notre engagement. Kofi Annan nous a appris que le savoir est pouvoir, mais agir, c'est transformer. Aujourd'hui, nous avons le savoir, demain, nous agirons. Nous nous engageons à servir avec intégrité en plaçant les populations au centre de nos actions. Innover avec audace car l'Afrique mérite des solutions africaines. Collaborer sans frontières car la santé est un bien commun. Inspirer la prochaine génération pour qu'elle ose rêver plus grand. Nous sommes les héritiers de Kofi Annan, les disciples de son leadership éthique et les soldats de sa vision pour un monde plus juste. À mes frères et sœurs de la cohorte 4, nous sommes et constituons une famille. Cette année, nous avons ri, lutté et grandi ensemble. Vous m'avez appris que la force de l'Afrique réside dans sa diversité et dans son unité. Aujourd'hui, nous devenons des ambassadeurs de ce programme, mais surtout des porteurs d'espoir. Que nos pas résonnent dans chaque village, chaque communauté, chaque centre de santé, chaque hôpital, chaque politique que nous influencerons. Que nos actions honorent ceux et celles qui ont cru en nous. En conclusion, permettez-moi de reprendre encore les mots de Kofi Annan. L'Afrique n'a pas besoin d'hommes forts, elle a besoin d'institutions fortes et de leaders au service du peuple. Aujourd'hui, nous faisons cette promesse. Nous serons ces leaders. Nous bâtirons ces institutions. Nous servirons ce peuple. Vive l'Afrique en bonne santé. Vive la cohorte 4. Vive l'héritage et l'esprit de Kofi Annan. Je vous remercie.
Ladies and gentlemen, let me just say, again, all the fellows were already leaders in their countries, but Fatima is a great example of someone who now through the program I think has just strengthened their gravitas, their diplomacy, their ambassadorial strengths, presentation, and we're so proud of her. Before I move on to the next fellow to give some remarks, can I just please get the permanent representative council members prepared to give some goodwill messages. So just to be clear, these are colleagues from Tunisia, Sierra Leone, Mali, Kenya, Togo, Ethiopia, Cape Verde, Madagascar. We will invite you to just give very short remarks, 1 minute because of time, after Jibril. So please be ready and please have your nominated person if there's more than one of you. If there are any other permanent representative members of the Permanent Representative Council that I've not read, please just give me a nudge so we don't cause any offence. I think Jibril would invite you. Big round of applause, please, for Jibril.
Distinguished ladies and gentlemen, I will just ride on the existing protocol and just follow on what my sister Fatima has said. On behalf of all of us, the graduating class of Cohort 4, we have been through a unique and transformational leadership journey. And this journey essentially has made us to appreciate very clearly the fact that there are problems across our various countries and across the continent. But beyond recognition of problems, what it has done to us that is unique is that it has challenged all of us to be problem solvers, to look for solutions. How do we solve the problem? Aliens from Jupiter will not come to Africa to solve African problems. We have to be problem solvers. There are so many unique features of this leadership fellowship that we are privileged to have participated in. I will just mention a few of them. One of them is that this is a unique leadership program developed in Africa by Africans for Africans. Please, a round of applause for the vision of the Africa CDC and everyone that has supported this fellowship by funding or in any other means. We go away with three things. One, a sense of pride as Africans. And that is very unique. To be proud to be an African in Africa and looking at the potentials that the continent has, not just fixating on the problems. The second key thing we take away is that all of us are committed. The Acting Deputy Director General of the Africa CDC, Dr. Taj, we are privileged to have learned from all of you, teaching us, giving us lectures at various, and inspiring us, not just sharing your experience, but inspiring us, has said that we have an invitation. And on behalf of all my colleagues, I'm sure we are going to say that, call us, send us, we are available, and we are very happy and proud to be of service to our fatherland. The other feature of this fellowship that we are very grateful for is that it is responsive. What do we mean? I wear two hats here. I'm also part of the first subcategory of mental health fellows in this leadership program. And you will appreciate that mental health problems are becoming a crisis on the continent. Our youths are being destroyed by drug abuse. And they are our future. We cannot close our eyes and neglect them. Mental health is present in sexual and reproductive health. Mental health is present in infectious diseases, TB, HIV, malaria. Mental health is present in cancer. So in all of these areas, Africa CDC and this leadership program is responsive by adding the mental health cohort. And on behalf of my cohort members, we are very appreciative and grateful for this opportunity. Now, what has happened is that we have deepened our understanding of public health. We have had fellowship with our other colleagues from other aspects of public health, and we are the better for it. And I want to believe that our other colleagues who are not from mental health backgrounds are also better educated about mental health by our interactions over the year. Part of this responsiveness is also the fact that we are aware that a sexual and reproductive health component is coming into the program. So this is responsiveness that is very good. So on behalf of my colleagues, all that remains for me is just to add our sincere and deepest appreciation to the African Union, to Africa CDC, and its leadership, His Excellency Dr. Jan Kaseya, who is not here, the Acting Deputy Director General is here, and all the leaders of the African CDC, all all the staff and members of Africa CDC is too long to mention. We've all appreciated the intense support, encouragement that has been there all through the course of the year. The Kofi Annan Foundation, and of course, Kofi Annan himself for being a shining beacon for all of us as Africans to look up to. And we are also very privileged that this fellowship is named after him. The Ethiopian nation, the government of Ethiopia and all her people, this is our second time here officially as Kofi Annan Fellows, and every time we've been welcomed very warmly. We felt very much at home, and very much as when we went to the museum, we were told that since the origin of the human race is in Ethiopia, so we are just coming back home. So thank you for welcoming us back home. We're also very grateful to the governments and people of the countries that we visited, the governments of Egypt, the government of Rwanda. Thank you all so much, and thank you for this opportunity.
Thank you, Jibril. Ladies and gentlemen, we're coming a little bit towards the end. Thank you for your engagement. Thank you for listening. Thank you for continuing the clapping. As I said earlier, we're now moving to hear from representatives from the Permanent Representative Council of the AU. So again, let me just read out the countries we're going to call. Just because of time, I'm going to ask politely that we keep our remarks a goodwill message, just as a show of support and solidarity, to a minute or two. So we'll call on colleagues from Tunisia, Sierra Leone, Mali, Kenya, Togo, Ethiopia, Cape Verde, and Madagascar. Can I ask that when you come, and for logistical reasons, I will bring this down a bit closer. Sorry, I've missed one.
No, we can do that there.
Oh, okay, we'll use the roving mic. That's even better. And please, when you begin, if you could introduce yourself with your name, your position, and just remind us the country first. So I think we will turn to Tunisia first, if that's okay. Please, a big round of applause for our colleague from Tunisia.
Good afternoon. My name is Nabil Masmoudi. I'm a councillor and the Deputy Permanent Representative of the Republic of Tunisia to the African Union. We would like to first thank Africa CDC and the Kofi Annan Foundation for this fellowship and for this fourth cohort. We would like also to congratulate our graduate for this, and especially our Tunisian, which also who also representing the North Africa as the only fellow now from the North Africa. We appreciate also the work of all, I don't know how